Thank you, Ambassador Eliasson, and congratulations on the new appointment. Your Excellency, President Kufuor, chair of this occasion, and colleagues, Tony, Rachel, ladies and gentlemen. Only 2 years ago, I was here to welcome you to the first high-level meeting of the Water and Sanitation for All Partnership. Maybe many of you were not here because I see a lot of new faces around the table. At that time, I was managing director in the World Bank, and now I'm delighted to be here again in a different capacity as Minister of Finance and Coordinating Minister of the Economy for the Federal Republic of Nigeria to further deliberate on the issue, given its monumental importance to the development challenges confronting our countries. Now also I'm an actor and a Minister of Finance who has to meet all the objectives and targets that we all talk about. As usual, my speech today is inspired by my personal experience, one or two stories that I'll share with you, as I hope to bring to your awareness that water and sanitation is not just an academic exercise, but a real issue for millions of people across the world. I had a personal experience with the issue of sanitation in 1979 when I was doing research for my doctoral thesis in 7 villages in Nigeria, and I lived in each one of them. And I remember living in a particular village in the north of my country, and as I was moving to the village, I was told to be very careful when you're taking your bath, make sure you have shoes on, and so on and so forth. And of course, being a young woman then, I didn't really listen to any of that. So I just did what I always do. I didn't pay particular attention. And nothing happened. But a year later, I got married. The next year, I had a baby. And after I had this baby, we were living in a place called Kidderminster in the UK. And I remember the baby crying, and, I put her to sleep downstairs. And then I went upstairs to try and do some work, tidying up in the rooms. And as I climbed the flight of stairs, I fainted at the top. And I was just lucky that my husband came in from the hospital where he was working at that time and found me passed out at the top of the stairs. And so he raised the alarm and was able to get me some help. And we had to investigate to find out what was the problem. That investigation, we're lucky we were in the UK where they're very attuned to tropical diseases. But the investigation showed that I was heavily infested with hookworms. And I had these hookworms, they were able to determine, and had the baby through the hookworms. By the time I finished, I was so depleted of iron, and that was why I passed out. And if nothing had been done, I might not have been able to live through it for much longer. So I'm here talking to you about water and sanitation out of a very real experience. Of course, I got the medicine, which I had to take over a 3-day period. I can't remember the name now, but it was one of the worst medicines I ever took in my life. But it saved me and cleared the hookworms. Now, it was clear that I had contracted these hookworms when I was doing this research in those villages. And I said to myself, well, how many more women who do not have the kind of luck I have to have access to medical care, to be found on time, live through this? Imagine if I was one of these women living in these villages and I had the first baby, then the second baby, any slight complication, I would have died without really knowing what it was all about. So I'm talking about this issue with a lot of passion, based on real experience. And it's one of the reasons why we must continue to search for innovative ways of addressing the challenge of having sustainability in our approach to water and sanitation services for our people. Now, this gathering of water and finance ministers across the developing world with our development partners must be one of the most unique opportunities to chart these innovative approaches and to bring collectively our top policymakers in our countries, our communities, our individuals, to work on these most pressing priorities. Let me now touch on the challenges, opportunities, and the way forward towards improving access to water and sanitation, and of course, the economics of it. While we can take some comfort in the recent WHO-UNICEF Joint Monitoring Program on Water and Sanitation report, suggesting that the world has met the MDG target of halving the proportion of people without sustainable access to safe drinking water from 24 to 11% since 1990, well in advance, as Tony and others have said, of the 2015 deadline. This must be for purposes of lesson learning rather than purposes of adulation. Let us be reminded that this 11% of the world's population equates to 783 million people who are still without access to safe drinking water. Only 63% of the world population now have access to improved sanitation, a figure projected to increase only to 67% by 2015, and well below the 75% aim in the MDGs. And as we've heard already, currently 2.5 billion people still lack improved sanitation. In fact, as Tony has said, 1.1 billion of these people still practice open defecation, including in my country. I therefore do not think we can declare victory or roll out the drums in any kind of celebration. Regional disparities bring the reality closer home. In sub-Saharan Africa, only 61% of the people have access to improved water supply sources, compared with 90% or more in Latin America and the Caribbean, North Africa, and large parts of Asia. Over 40% of all people globally who lack access to drinking water live in sub-Saharan Africa. At the current rate of progress, it will take us an unacceptably long time to make access for the people who need it. Sanitation is the second most off-track MDG in sub-Saharan Africa after maternal mortality. From an economic standpoint, the new World Bank report on water and sanitation shows that 18 African countries lose around $5.5 billion in total, or between 1 to 2.5% of GDP per country every year, due to poor sanitation. About 114 million, or nearly a quarter of the total population of these 18 countries, defecate in the open, costing the economy about $2 billion per annum, including the cost of lost time in finding a discrete location. The cost to my country, Nigeria, which is one of the 18 countries surveyed, is enormous. And this is a challenge to me and my fellow policymakers at $3 billion a year. It's equivalent to $20 per person per year, or 1.3% of our GDP. As recently as 2006, the economic impact of inadequate sanitation in India was estimated at $53.8 billion a year, the equivalent of 6.4% of its GDP in 2006. Pakistan also loses $5.7 billion annually, or 3.9% of its 2006 GDP. In other countries, the impact varies from a low of 1% to a high of 9% of GDP. These figures reflect to a large extent the adverse health effects associated with consuming polluted water and poor sanitation practices, and the ensuing loss of productivity and cost of treating these health effects. However, startling as these figures may be, they are still on the conservative side, and they do not include the costs associated with environmental impacts and the adverse impacts on tourism and business. Water and sanitation thus impact every facet of the lives of our citizens. To put it mildly, we will not make much progress in the fight against poverty if we do not address the challenges of water and sanitation effectively. Analysis also shows that the health burden of poor sanitation falls disproportionately on children living in poor households as a result of both greater exposure to infection and increased susceptibility. And they are more susceptible to diarrheal diseases, as we have heard, and suffer higher mortality. Approximately 121,800 Nigerians, including 81,100 children under 5, die each year from diarrhea, nearly 90% of which is directly attributable to poor water, sanitation, and hygiene. On a global scale, more than 3,000 children still die, again as we've heard, on a daily basis from diarrheal diseases. As the developing world faces the challenge of food security, water and sanitation are implicated in exacerbating malnutrition for children from poorer households. Malnutrition and stunting results in lower school and work productivity from impaired cognitive function and learning capacity. There is also a gender dimension, of course, to the issue of water and sanitation. Those of us from developing countries know the drudgery imposed on women by long collection times to fetch water, preventing them from being more productive in the economy. I also have had a lot of personal experiences with working long hours to fetch water as a teenager during the war in Biafra, when we were in civil war in Nigeria, the Nigeria-Biafra war. When, as we were running from place to place, we increasingly were living in villages with no access to water, and we had to walk miles to be able to find a decent water source. Again, those experiences stay in my mind and speak to me about the lost time and productivity when people do not have access to clean water. Many countries also face a funding gap as government spending on water and sanitation falls significantly short. This is partly due to the fact that many countries do not see the link to growth. A recent public expenditure review on water supply and sanitation in sub-Saharan Africa shows that, as Rachel Kite said, on average, only 2% of total government expenditure goes towards the sector. At their Tekwini Declaration in 2008, African countries committed to increase their budgetary allocations for sanitation to at least 0.5% of GDP. However, none of the 18 countries surveyed, including mine, have reached the target yet. Only 5 of these countries invest between 0.1 and 0.5% of GDP on sanitation. In most countries, current investments in sanitation are less than 0.1% of GDP. More importantly, the developing world cannot continue to rely on donor funding to bridge the funding gap. New evidence shows that donor financing is not targeted at countries with low levels of access, but at relatively richer countries that have already made some progress on access. We have to look more to our domestic resource mobilization in proper targeting to help tackle this problem. As Finance Minister, I fully understand the challenges countries face to increasing spending on water and sanitation against other competing expenditure. In fact, I usually frown at all these dedications of different slices of the budget to different types of targets. Because I remember once at a cabinet meeting we had when the Minister of Agriculture, this was during my first time as Finance Minister, said we were to dedicate 10% of our budget to agriculture. The AU had said so. The Minister of Education said UNESCO had said 25%. The Minister of Health said another slice. And by the time we added it up, I told the President we are going to close to 110% of the budget. So I usually do not like these dedications. But for the water and sanitation, maybe it's out of the personal experience, maybe it's out of the total loss in productivity. I think that I would urge my colleagues, for all of us, to look at how we can better define and better prioritize this expenditure in our budgets. And I know that I have my colleagues from the Ministry of Water Resources and Sanitation and Environment here, so they'll quickly run and tell the minister who is not here. So I'll be held accountable in the 2013 budget, isn't it? But government policy should not only be to increase its own funding, but to leverage investments from other sources. This includes harnessing and optimizing household and private sector investment. Economic returns on sanitation and water projects are highly favorable. Analysis of projects in Asia and Africa show average rates of return exceeding 20% annually. This rate of return is significant enough to incentivize private sector participation. Several benefits of improved water and sanitation are intangible impacts, rarely captured in economic studies because they are difficult to measure. These include dignity, comfort, privacy, security, and social acceptance. Not surprising that some countries have prioritized getting water closer to the people. We see enormous growth in piped water connections in East Asia, for instance. Cost-benefit studies on water, supply, and sanitation for sub-Saharan Africa, which took into consideration health improvements and time savings, estimated the benefits to be 2.8 times the cost of water supply and 6.6 times the cost of sanitation. Improving water and sanitation is therefore an opportunity to ensure continued economic growth. I want to repeat this. Improving water and sanitation is an opportunity to ensure continued economic growth, especially given the recent evidence of sustained economic growth in Africa, despite the financial crisis. We don't want anything to slow this down. I, for one, will not want this to happen to us in Nigeria. Notwithstanding the challenges we face, our economy grew about 7.32% last year, one of the highest growth figures over this period. I imagine to myself what would happen if we could remove the bottlenecks and get more women to work by improving water and sanitation. This will mean increased agricultural productivity, increased employment, increased time spent educating children and building skills, and more importantly, improvement in the overall quality of life and human dignity. So this is an investment well worth making. Robust planning is key. This is still lacking. According to the 2012 UN Water Glass Report, many countries still lack clear institutional arrangements and do not as yet have agreed investment plans. This is where institutions like the World Bank, UNICEF, USAID, DFID, and the partnership must do its part. These organizations with the extensive international experience can assist by providing the expertise to help countries develop robust and realistic plans. I, for one, intend to convene an interministerial committee involving my colleagues in the water resources, environment, and health ministries, and our donor partners, where we'll try to put together a workable plan. We need to create these plans and link them to sources of finance in order to reap the economic returns which good water, sanitation, and hygiene can offer. We must ensure no credible plan able to deliver sanitation and water for all fails for lack of finance. For this to happen in a sustainable manner, we need to involve our communities and bring in more strongly the private sector. And we have successful examples of such arrangements. In Senegal, for example, the government launched wide-reaching reforms in the urban water sector. The reforms consisted of dissolving the state-run water company and creating a new asset holding company which had the mandate to manage the sector, and a private operator was engaged to run the production and distribution. More than 15 years later, this framework is still running, and 98.5% of the urban population has access to safe water, and 80% with private connections. Our next step must be to target the most difficult to reach, the poorest, and the most disadvantaged people across the world, while making open defecation an issue that needs to be resolved urgently. Ladies and gentlemen, I must not hesitate to mention that sanitation and water in sub-Saharan Africa needs particular attention, as this is holding back improvements across all other MDGs, including education, maternal and child health, and poverty reduction. I therefore appeal to you, my dear friends and colleagues, as ministers of our countries, to take firm actions to reverse the global sanitation and water crisis before it's too late. Let us commit to delivering real progress towards achieving sanitation and water for all. We have reached an important milestone in the progress to the MDG targets, but more needs to be done. We must ensure the priorities sanitation and water for all, that is, every person having sustained access. Let us then work together with our own people, our communities, our local governments, our state and provincial governments to make progress in changing behavior and in making the needed investments. It can be done. It must be done. Thank you, ladies and gentlemen.